Preparation is key to having a classroom atmosphere that feels safe and welcoming to everyone, children and adults. These suggestions will help the lead teachers feel ready and able to support an environment that sees and welcomes everyone, where everyone counts. Gather background information that can be readily posted and is handy to refer to when speaking to children and parents by name. A reference card with each child's family members' names and their schedule could be right above the child's cubby, along with their birthday month and year. Did they just turn 5 or are they nearly 6? Have they been to school before or is this their first time? Some of your labeling and systems can be created before the children arrive. Names on cubbies and sit-upons and place cards can be done ahead of time. A job chart and clothespins and popsicle sticks with children's names can be labeled and ready. After the children arrive, they can make their handprints for the job chart and trace footprints for lining up. This helps them make the classroom their own, to feel ownership and responsibility for the have-tos. This is where my helping hands and feet are with other helping hands and feet. The Kindness Counts jar is a touchstone daily event that teaches social-emotional skills. This one routine is so helpful in creating a safe and happy atmosphere where learning can be best achieved. It takes this vague word and concept of kindness and translates it into actions and words. When children know that their words, actions, and attitudes will be recognized every day, they help to make their classroom a safe and secure place to be. Oh, we're kind and growing kinder only need a small reminder to include each one and keep it fun for everyone around. Kindness counts is that small reminder. Let's talk about medication, one of the most common and underestimated risks in childcare settings. When we think of medication hazards, we often picture a child accidentally finding a pill bottle and swallowing something they shouldn't. And yes, that does happen. But there's another, often overlooked danger: adults administering medication improperly. That's right, sometimes it's the caregiver who unintentionally causes harm. The wrong child receives the medicine. The wrong dose is given. Or medication is given at the wrong time. Even if your intentions are good, a small mistake can have serious consequences. So today, we're going to focus on how to prevent both types of medication-related injuries: accidental ingestion and administration errors. Locked with key first, let's prevent access. Children are curious. They explore with their eyes, hands, and mouths, and they move quickly. To protect them, store all medications, prescription or over-the-counter, in a locked cabinet at all times. Not high up. Not behind a door. Locked. Never leave medication unattended, even for a moment, not on a shelf, desk, or changing table. Do not keep personal medication in purses, pockets, diaper bags, or lunch boxes within children's reach. This includes vitamins, antacids, or allergy meds. Even those that seem harmless can be dangerous in tiny bodies. Clean up spills immediately and follow safe disposal guidelines for expired or unused medicine. If a child swallows something they shouldn't, even just a nibble, it's a medical emergency. Keep poison control and emergency contact numbers posted clearly and included in your emergency plan. Now let's talk about giving medication. In a licensed program, you must follow strict procedures before administering anything. That includes a signed medication consent form from the parent or guardian, a medication log that includes the name of the medication, the dosage, the time it should be given, and who gave it. The medication must be in its original container, with the child's full name, dosing instructions, and expiration date visible. Never guess or assume dosage based on a past schedule. Mix up medications between children. Rely on memory. Administer medication from a shared bottle, even among siblings, and if you ever feel unsure, stop and ask. Mistakes happen when we rush, assume, or multitask. Test tube. Here's a real-life example. In one program, a teacher gave a child cough syrup intended for a sibling with the same last name. The bottle looked identical, and she thought she was helping. Unfortunately, the child had a seizure from an allergic reaction. The program was cited for a licensing violation, but more importantly, that child was harmed by something that could have been prevented with one extra check. So here's a simple rule: check the label. Check the form. Check the child. Every time. Finally, if a child needs medication regularly, like asthma inhalers or EpiPens, those items must be stored safely but easily accessible during an emergency, clearly labeled with instructions known to all staff responsible for that child's care. Train your team. Document everything. And follow the policy as if your license depends on it, because it does. Medication can be life-saving. But in the wrong hands or used incorrectly, it can be life-threatening. So slow down, lock it up, and double-check everything. It's not about distrust, it's about diligence. And in early childhood care, diligence saves lives. Now that we've talked about the risks of improper medication use, let's go over one of the best ways to avoid mistakes: proper documentation. In Kentucky, all early care and education professionals must follow clear guidelines when it comes to administering medication. And it starts with this simple rule: no medication should ever be given without daily, written permission from a parent or guardian. Let me say that again, because it surprises people: daily. Written permission. This applies to both prescription and non-prescription medications. Whether it's a doctor's prescription for antibiotics or an over-the-counter allergy syrup, parents must give written permission every single day that medication is administered. That means even if a parent brings a bottle and fills out a form on Monday, you cannot give the same medicine on Tuesday unless you get fresh written permission. One-time permission is not enough. Not for Tylenol, not for diaper cream, not even for teething gel. This applies to all licensed and certified child care programs in Kentucky. And yes, even if your center has its own policies or practices, this daily documentation is non-negotiable under state regulation. Blue Book. Let's talk about the log. In addition to written parent permission, every Type 1 and Type 2 licensed child care program must maintain a medication administration log. This written log is more than just a paper trail. It's a legal record, a safety measure, and a way to hold ourselves accountable. The log should include the child's name, the name of the medication, the time each dose is given, the date, the amount given, and the name of the staff person who administered it. And yes, every dose must be logged. Even if you've given it before. Even if you're the only one there. Even if the parent just told you this morning. It might feel repetitive, but think about it: this protects you, your coworkers, and most importantly, the children. If anything ever goes wrong, this log becomes your record of responsible action. Speech balloon. Let's pause and reflect. Ask yourself, do I know what our program's medication administration policy is? Who is authorized to give medication in my center? What forms are we using, and are they compliant with Kentucky's regulations? If you're not sure, now is the time to find out. Ask your director or supervisor. Because you can't follow what you don't understand. Magnifying glass tilted left. Check your handout. You can find more details about recommended documentation on page 13 of your participant handout. It outlines what good medication logs should include, even though Kentucky doesn't mandate a specific form. So whether you use a printed sheet, an online system, or a clipboard in the health room, what matters is that the information is complete, legible, and done every time. When it comes to medication, prevention isn't just about locking up the bottle. It's about documenting every step, clearly, consistently, and according to the rules. Because in this profession, good paperwork isn't busy work, it's child safety. Let's take a moment to reflect on this quote from Dr. Poole, shared in the Healthy Child Care America newsletter way back in 1999. There is a tremendous chance for missing a dose, giving too many doses, giving the wrong amount, or giving the medication at the wrong time. Even though this statement is over 20 years old, it's just as true, if not more urgent, today. When it comes to administering medication to young children, the risk of error is always present. And the reason is simple: children are not small adults. Their bodies are still developing. A small mistake with medication, just a little too much, or a little too late, can lead to very big consequences. And in a fast-paced early childhood environment, we're juggling a lot: crying babies distracted toddlers' parents at the door, scheduled feedings, playground prep, cleaning duties, and sometimes a dozen different allergy plans or medication instructions. So yes, the chances for accidental errors are high. But here's the good news. Those errors are also 100% preventable. Brain, let's unpack the quote. Missing a dose. If a child depends on medicine for a chronic condition, like asthma, seizures, or ADHD, skipping a dose can mean symptoms flare up or a medical crisis occurs. That one missed entry in a logbook might mean the next caregiver assumes it's already been given. Giving too many doses. This can happen easily when two caregivers don't communicate, or if a log wasn't updated. One teacher gives medicine in the morning, and another repeats it after lunch. Giving the wrong amount. Maybe a parent gave vague instructions. Maybe the teaspoon wasn't clearly marked. Maybe the decimal point was missed. The difference between 0.5 milliliters and 5 milliliters might not sound like much, but in a toddler's body, that can mean a trip to the ER. Giving the medication at the wrong time. Some medications require exact timing to work properly. Missing a window, even by an hour, can impact a child's symptoms, recovery, or safety. So when Dr. Poole calls this an accident waiting to happen, he's not criticizing child care providers. He's naming a risk and asking us to take it seriously. Receipt. So what do we do with this information? We remember it. We post it. We talk about it. We review our own policies and practices regularly. Because the truth is, it's not enough to care. It's not enough to do your best. When medication is involved, we need to slow down and follow the documentation steps every single time. Let's walk through something every child care professional needs to know, whether you give medication once a week, once a month, or every day. It's called the 5 rights, and it's your best line of defense against accidental harm when administering medicine. We say, get it right. Ask yourself, do I have the right? This is more than a checklist. It's a moment to pause. A built-in safety stop that helps you slow down, double-check, and protect the children in your care. Let's break it down. 1. The right child. This sounds obvious, but in a busy classroom or when children have similar names, mix-ups can happen. Always read the medication label and compare it with the child's name on the medication request form and the medication log. If there's ever a doubt, pause and clarify. Never guess. You should never rely on memory alone, even if you've known the child for months. Always follow the paper trail. 2. The right medication. Now ask, am I giving the right medicine? Check the bottle or packaging carefully. Look for the child's name, the medication name. Watch for look-alike or sound-alike drugs, the expiration date. Even if the bottle has been in the classroom for a while, don't assume it's still okay. Expired medicine loses effectiveness, or worse, becomes unsafe. If you're ever unsure, do not give the medication until you verify it. 3. The right dose. Now consider the amount. Is it the correct dose as written by the parent or prescribed by the doctor? Using the wrong spoon, guessing, or assuming a little more won't hurt can lead to serious harm. Always use proper measuring tools, droppers, oral syringes, or dosing cups with clear markings. Kitchen spoons are not reliable for dosing. And if you're unsure what 1 teaspoon looks like in a syringe, ask a supervisor to walk you through it. 4. The right time. This one's easy to overlook, especially in a busy day. But giving medicine too early or too late can reduce its effectiveness, cause side effects, interfere with a child's natural rhythm or other treatments, so make sure you're giving the medicine at the exact time requested. Set a reminder if needed. And always document the time it was administered in your logbook immediately after giving it. Delaying that entry, even by a few minutes, increases the risk of forgetting or duplicating doses. 5. The right route. Last but not least, ask yourself, am I giving this medication the right way? Route refers to how the medicine is given, by mouth, oral, on the skin, topical, in the eyes or ears, drops, inhaled through a nebulizer, injected. If trained and authorized to do so, it's crucial to read the label and instructions carefully. Giving eye drops in the ear? That's a mistake. Swallowing something meant to go on the skin? Very dangerous. Brain, let's recap. Every time you give medication, even if it's just cough syrup or just a cream, ask yourself these 5 questions. Am I giving it to the right child? Is it the right medicine? Is it the right dose? Am I giving it at the right time? Is this the right route? If you can't confidently answer yes to every single one, stop and ask for help. Speech balloon real talk. In the classroom, you might be rushed. You might be pulled in 6 different directions. You might feel pressure to just get it done. But a 2-minute double check can prevent a lifetime of regret. So post the 5 rights where everyone can see them. Train your substitutes. And remind each other, gently but firmly, when it's time to pause and verify. Because getting it right isn't just a checklist. It's a commitment to care. Go ahead and read the slide, get it right. Ask yourself, do I have the right child? Now, that might sound like a no-brainer, right? I mean, you know your kids. You see them every day. How could you not give the medication to the right child? But here's the thing, mistakes do happen. And in a busy, high-energy environment with multiple children and shifting routines, it's surprisingly easy to get mixed up. Let's talk about some real-life situations that increase the risk of this kind of error. Brain, let's brainstorm. When and how might this happen? You've got a substitute in the room. They don't know who's who, and suddenly they're asked to give out a medication without a second adult nearby. That's risky. You have children with the same name. Maybe you've got 2 Jacksons, or a Jalen and a Jaden. It's easy to glance at a label and make a snap judgment, especially when you're in a rush. 2 children are scheduled for medicine at the same time. You're holding a dropper for one, a chewable tablet for the other, and your name tags fell off earlier that morning. That moment of confusion can have serious consequences. So how do we reduce this risk? Let's start with a very simple but powerful tip. Never ask, "Are you John?" Children are eager to please. Even if they're not John, they might say yes. Instead, ask open-ended questions like, "What's your name? Can you tell me your first and last name, or even who's your teacher? What color is your cubby?" Anything that prompts a child to independently verify their identity. Also, avoid group dosing. When it's time for medication, focus on one child at a time. No multitasking. No giving out meds while managing snack or diapering or playground prep. Just one-on-one attention for that child in that moment. Label visual reminders and documentation help too. Keep each child's medication in a clearly labeled container. Double-check the child's name on both the bottle and the written request from the parent. Record the dose immediately after administering it, before moving on to anything else. If you're ever unsure, stop. Ask another adult for support. Check the roster. Confirm with the child. It's always better to take an extra minute than to risk a dangerous mix-up. Megaphone, let's be real for a moment. We know early educators are superheroes. But even superheroes need systems in place to keep kids safe. So before giving any medication, pause and ask, do I have the right child? Do I have documentation that proves it? Am I giving this medication without distraction? This one small question, do I have the right child? Can prevent the kind of mistake that nobody wants to make. And it's one of the easiest ones to get right, if you stay focused, present, and methodical. Let's keep that commitment to safety strong, even when the day is long and loud and busy. Because every child deserves that level of care. Take a moment to read the slide, get it right. Ask yourself, do I have the right medicine? This is one of the most critical steps in safe medication administration, and also one of the easiest to get wrong. Let's think about why. Package. First of all, many medications sound alike. Let's say you have cetirizine and ciprofloxacin sitting side by side in the cabinet. In a rush, your brain might register the first few letters and fill in the rest. But those are two very different medications, one's for allergies, and the other is a powerful antibiotic. Now imagine this: a child in your program is taking amoxicillin twice a day for an ear infection. Another child is on albuterol for asthma. You're working with a sub. It's busy. The meds are in similar containers. You can see how easy it would be to grab the wrong one. This is why visual confirmation is not enough. You must read the label every time. Page facing up, and here's where your system matters. You should be doing two things every time you give medication. White heavy check mark. Step number 1. Compare the medication container with the parent's written permission slip. Is the medication name an exact match? Is the dosage strength the same as what's written? Is the expiration date current? Is this the right child? This step helps you make sure the intent matches the reality. Parents might bring in the wrong bottle or forget to update instructions. You need to spot the mismatch before it gets to the child. White heavy check mark. Step number 2. Use the triple check method. You should check the medication name 3 times. When you first pick up the container, don't assume it's what you think it is. Look at the label and read it out loud if needed. As you prepare the dose, whether it's a liquid, tablet, or inhaler, pause and double-check before measuring or opening. Right before giving it to the child, take one more look at the label. Confirm it against your written record. Ask yourself, am I about to give the correct medicine to the correct child, at the correct time, in the correct amount, in the correct way? This last check is your safety net, your final pause to catch a mistake before it happens. Magnifying glass tilted left. Think about your classroom setup. Where are medications stored? Are they clearly labeled and separated by child? Can someone else easily pick up the wrong one? If you're not sure, take time today to review how medications are organized. Set up a system that helps you and your coworkers avoid confusion. Here's a tip from a veteran early childhood provider. Whenever I give medication, I talk to myself out loud. I say the child's name, the medicine name, the dose, and the time. It helps me focus and signals to others that I'm in the middle of a critical task. That kind of verbal routine is a powerful way to prevent errors, and it creates a culture of safety that everyone can follow. Stop sign. So before you ever open a bottle or pop a tablet out of a pack, ask, is this the right medicine? Is this the right dose of the right medicine, for the right child, at the right time? Never skip this question. Because once a medication is given, you can't take it back. Let's stay alert, be methodical, and protect the children in our care, one label at a time. Go ahead and read the slide, get it right. Ask yourself, do I have the right dose? Now let's talk about why this one matters so much, and why it's easy to get wrong if you're not paying close attention. Warning: medication dosage is one of the most common causes of serious mistakes in early childhood programs. That's not just a guess, it's backed by national safety data. Too much medicine can poison a child. Too little can fail to treat the condition and delay recovery. So how does this happen? You might be surprised to hear this, but a common reason is using the wrong tool to measure. Spoon: picture this, you're in a hurry. The only thing nearby is a kitchen spoon, so you grab it, pour the medicine, and assume it's about a teaspoon. Except it's not. A kitchen teaspoon or tablespoon is not an accurate measuring device, even if it looks close enough. And a little too much or a little too little can make a big difference depending on the child's size and the strength of the medication. Test tube: this is why programs sometimes do the measuring spoon experiment during training. They give 5 people a standard kitchen spoon and ask them to measure what they believe is 1 teaspoon of water. The results? 5 different amounts, often ranging from half a teaspoon to more than 1.5 teaspoons. And that's with water, which is easy to pour and see. Now imagine if that liquid were a fever reducer, an antihistamine, or a prescribed antibiotic. You can see how this goes wrong, quickly. Light bulb: so here are the key takeaways. Only use proper medication measuring tools. That might be a calibrated dropper, an oral syringe, or a dosing cup that comes with the medication. Never use tableware, even if you think you know what a teaspoon or tablespoon looks like. Don't make your own conversions. Let's say the bottle says 5 milliliters and you only have a teaspoon measuring cup. Don't guess. Don't Google. Don't wing it. If the units don't match the tool, stop and ask a supervisor or call the child's doctor. Input Latin uppercase another problem? Abbreviation confusion. T or TBSP stands for tablespoon, that's 15 milliliters. T or TSP means teaspoon, that's 5 milliliters. Mixing these up means you might give triple the intended amount. That's a huge deal for a toddler whose whole body weight is only 25 pounds. Clipboard: the safest approach is to treat each dose like a precision task. Because it is. Confirm the written instructions. Read the label carefully. Use only the provided dosing device or a pharmacy-calibrated alternative. And when in doubt, pause, check, and ask. Brain: one more tip: slow down. Even when the day is hectic, even if the classroom is loud, giving medication is a moment where you must create calm around you. It's a serious responsibility, and you don't get a redo. Let's make it a habit to ask ourselves every single time, do I have the right dose and the right tool to give it? That one question can prevent one of the most common and preventable medication errors in early care settings. Let's do a quick hands-on experiment together. Read the slide title, which is more accurate. Now take a look at the images. On the left, you've got medicine bottles and a syringe. In the middle, you see a standard tableware spoon, the kind you'd find in your kitchen drawer. And on the right? Measuring spoons, the kind that come in a rainbow of colors, usually clipped together on a ring. This activity is going to show you why using the correct tool matters when you're giving medication to a child. Microscope first, let's talk about the difference between eating utensils and measuring tools. A tableware teaspoon or tablespoon is designed for eating, not for measuring. That means there's no standard size, and they vary in shape and depth. The same goes for those flimsy plastic spoons we often see at parties or in break rooms. They're convenient, sure, but not precise. When it comes to medication, precision is everything. Test tube: so here's the experiment. Fill a tableware teaspoon with water, just a regular spoon you'd find in your kitchen drawer. Now grab a medication syringe, the kind you'd use to measure and administer liquid medicine, and try to pull out exactly 1 teaspoon of water from that spoon. Droplet: you'll probably notice there's extra water left in the spoon. That means your teaspoon is actually more than a real teaspoon. And if you gave that amount to a child, you'd be overdosing them even though it doesn't feel like it. Now repeat the process. This time, use a measuring spoon, one that's labeled as 1 teaspoon. Fill it with water, and then use the same syringe to pull the liquid out. You'll likely still see some variation, not as much as before, but possibly still off by a little depending on how the spoon was filled. Now try with a plastic spoon from a party supply drawer. You'll probably see even more variation. Direct hit: the takeaway? Only a calibrated syringe or dosing cup, ideally the one that comes with the medication, should be used when administering medicine to children. These tools are made for accuracy, not convenience. And in early childhood care, accuracy can literally be the difference between safe and unsafe. Warning: why does this matter? Because when we give medication based on eyeballing it or guessing how much fits in a kitchen spoon, we're playing a dangerous game. Even half a milliliter too much can matter for a toddler whose body is tiny and developing. Think of it like pouring bleach into a washing machine. A little extra might not ruin your clothes, but with medicine, that little extra can cause serious harm. Speech balloon: so here's what we want you to remember. Kitchen spoons are for cereal, not medicine. Measuring spoons are better, but still not perfect for giving doses. Syringes and medicine cups that come with the medication are the gold standard. If a parent drops off medicine without a measuring tool, ask for one. If you don't feel confident about the amount, stop and get clarification before giving it. Brain, this activity isn't just about liquid and spoons. It's about being intentional, accurate, and confident in how we care for children's health. So the next time someone hands you a bottle and says, "Just give them a teaspoon," don't grab the silverware drawer. Ask yourself, which tool is more accurate? And now you know, it's the one designed for medicine, not mashed potatoes. Let's talk about one of the most overlooked yet critically important questions to ask before giving any medication. Do I have the right route? The route simply means the path the medication is supposed to take to get into the child's body. Most people think of medication being taken by mouth, but in a childcare setting, it could also be given in the eyes, ears, nose, on the skin, or even inhaled through a nebulizer. Now, let's pause for a second. Imagine giving ear drops in a child's eyes. Or putting an ointment meant for the skin into a child's mouth. Not only would that be ineffective, it could actually cause harm. So how do we make sure we get this part right? Step 1. Always read the label. That might sound obvious, but when things are busy, during transitions, while managing behaviors, or when a child is crying, it's easy to move too quickly and assume. Read the label carefully. Look for instructions like, apply to affected area twice daily, instill 2 drops into each ear, shake well before using, give by mouth with food. Step 2. Follow directions exactly. The dosage method might include details like, do not use with other eye medications, wait 5 minutes before administering additional drops, store in refrigerator. Even these small instructions can make a big difference in how effective and safe the medicine is. Step 3. Prepare the right supplies. If it's ear drops, you may need a towel or tissue. For eye drops, a second adult might be helpful to steady the child. For topical creams, you'll want gloves. For inhalers or nebulizers, you'll need the child's specific equipment. And of course, wash your hands both before and after. Let's talk briefly about some of the common routes you might see: oral, by mouth, liquid, chewable, or tablet form; topical, on the skin, creams, ointments, or patches; otic, eardrops; ophthalmic, eye drops or ointments; inhaled, through a nebulizer or inhaler; nasal, sprays or drops into the nose. Each route has its own best practices and safety tips. For eye drops, don't let the dropper touch the eye. For ear drops, pull the earlobe down and back for young children to help it flow into the ear canal. For topical ointments, always use gloves and apply to clean skin. For oral medications, make sure the child swallows it completely and doesn't spit it out when you're not looking. One last thing, do not guess. If there is any confusion about how a medication should be given, pause and ask. Contact your director, the parent or guardian, or even the child's healthcare provider if needed. It is always better to double-check than to make a mistake that could have serious consequences. Wrap up, the key message here is, even if you have the right child, the right medication, and the right dose, if you give it the wrong way, it can still be dangerous. So always slow down and ask yourself, do I have the right route? Let's keep children safe by paying attention to the details, every single time. Let's talk about a few essential steps for ensuring medication safety in early care and education settings. First, always administer medicine in a well-lighted room. This might seem like a minor detail, but proper lighting is critical. You need to clearly see the child, the medication label, and the dosage measuring tool. Poor lighting increases the risk of giving the wrong amount or even grabbing the wrong medication. It also makes it harder to notice signs of an allergic reaction or side effect. Next, make sure the child receives the entire dose of medicine. If for any reason the child spits it out, refuses to take it, or only swallows part of the dose, do not give more without talking to the parent or guardian first. It's important that you don't guess how much they actually took. Call the parent and let them decide, usually with advice from their doctor, how to proceed. This avoids the risk of overdosing or giving the wrong amount. After the medicine is given, your job isn't done. You need to observe the child for any side effects. These could be minor, like a rash, or serious, like difficulty breathing or excessive drowsiness. If anything seems off, don't hesitate to call the parent right away. You are that child's advocate, and noticing something early could prevent a medical emergency. Even if no issues come up, it's still important to have the parent sign off on documentation when they pick the child up. This shows that you administered the medicine, what you observed afterward, and confirms that the parent is aware of everything that took place. It also protects you and your center by creating a written record in case there are questions later. So to recap, medication safety isn't just about the medicine, it's about the full process: right environment, correct dose, careful observation, and clear communication with families. If you're ever unsure, always ask your supervisor or check your program's policy. And if something unexpected happens, write it up thoroughly and be transparent with parents. Why should you give medicine in a well-lighted room? Because details matter, especially when it comes to children's health. Proper lighting helps you clearly read the medication label, confirm the child's identity, and accurately measure the dose. It also allows you to notice if the child is showing any immediate signs of discomfort or allergic reaction. Something as simple as a shadow or dim corner can cause you to miss a detail that could lead to a serious mistake. So always position yourself in a bright, distraction-free space when administering medication. It's a small habit that makes a big difference in keeping children safe. What might prevent a child from getting the full dose, as prescribed? Great question, let's brainstorm. Sometimes the child might spit out part of the medicine or refuse to take it at all. You might also accidentally spill it during preparation or use the wrong tool, like a kitchen spoon instead of a dosing syringe. It's also possible the child may cough or gag mid-dose and lose some of it. And of course, distractions in a busy classroom could lead to interrupted dosing or missed steps. If a child doesn't get the full dose, don't guess or give a second dose. Always call the parent and have them check with the child's doctor for the next steps. Now, if you're new to an early care program, you may not be the one deciding where medications are stored, but it's still your responsibility to follow the rules for storing them correctly, every single time. First off, all medications must be kept in a locked place. That means not just out of sight, not just high up, but actually locked. This includes both prescription and over-the-counter meds. And that rule applies to your personal medications, too, anything you're taking that could pose a risk to a child. Second, medications must be out of children's reach at all times. That might sound obvious, but remember that children are curious, fast, and often more resourceful than we expect. A purse on a desk or a backpack in the corner isn't safe enough. Next, if a medication requires refrigeration, it can't just go in the fridge with the lunchboxes. It needs to be inside a locked container within the refrigerator, unless you're in a certified home, where a locked area is permitted instead. Also, only the original bottle should be used. Don't transfer medications to unlabeled containers or plastic bags. Why? Because you need all that label information, dosage, expiration, instructions, to ensure safety. And last but not least, the bottle must be properly labeled, not just with the drug name but with the child's name, too. This helps prevent one of the most dangerous errors, giving the right medicine to the wrong child. So even if you're not responsible for creating your center's medication policy, you are responsible for following it. That means double-checking that meds are locked, labeled, and stored exactly as required every single time.